Hello, good morning. I'm John Morris and I'm the consultant looking after your mum.
Right.
This is Jennifer.
Hello.
She's one of the staff nurses on the ward too. I realise everything's must have come as a shock to you. Can I just check what you know and what's happened?
I got a call this morning from my mum's carer. She let herself in to my mum's because she gets my mum up in the morning, and she found her lying on the hall floor, and she tried to get her to stand up. She couldn't get her to stand up, and she couldn't get her to make any sense. So she realised that something had happened to my mum, and she called an ambulance.
Okay. Now, I know you see your mum pretty often.
Yeah.
When did you last see her?
Well, I last saw her a couple of days ago, but I phone her every night. I phoned her last night, and because she's been very nervous since my dad died, and she doesn't like being on her own. And I phoned her just to check she's okay. And I spoke to her last night, and she was just getting ready for bed.
And she was completely fine to you on the phone?
Yeah, she was fine. She'd been to the day centre. She'd been shopping with her friend, and then she said she was quite tired, and so she was going to bed, but she sounded fine.
Okay. Now, can I just double check if anybody's told you anything at all? Any nurses, doctors told you what's going on?
No, I just came in and they said that was having some kind of scan.
Yeah.
And she said that someone would come and talk to me. I don't know what's going on.
Okay, well, I can tell you what's going on. So that's what I'm here for. The carers were obviously pretty worried about her, which is why they called the ambulance. And we were initially worried that she'd had a stroke. Okay, so that was why we rushed her into the brain scan. And we did the brain scan, and what this brain scan shows is that she has had a stroke. Okay. And this stroke has been a bleed into the brain. So she's had a bleed in her brain, which has caused her to be so unwell. Okay.
No, what happens now?
Okay. Well, we're going to look after your mum, but the stroke that she's had is very large. Okay. And it's been quite a lot of bleeding within her brain, which is making her so unwell. Okay. Now, I wish I did, but at the moment I don't have a specific treatment that can get rid of that blood.
But surely there's all sorts of treatments now.
We have some treatments for some types of strokes, but not this type of stroke. I've phoned the surgeons just to see if there's anything they could possibly do, but they say that the operation itself would be too dangerous. Okay. Now, my fear and my worry is that this has been such a big stroke that she may get worse, and she even may not survive.
Worse?
Okay.
But I thought you could do... Is there absolutely nothing that you can do?
I'm afraid not. What we need to do now is look after her and try and keep her comfortable and keep her pain-free, and we'll look after her in the ward and move her into a single room.
This is hard for you. We can talk about how we'll look after your mum now or later if you like. But we'd like to understand what's important for you and your mum.
Yes, I see that.
I'm worried, and I'm expecting that she might die in the next few days.
Can I see her?
Of course, we'll take you through to see her just when we're finished. Have you got any other questions you'd like to ask us?
Well, what happens now?
Okay.
Can I phone my husband? I need to phone my husband. And my brother's in Canada. I mean, he was here about a month ago, and she was fine. and I mean, she was a bit frail, but her mind was great. So I need to phone him, but she seems fine. Is there something I should have noticed?
No, absolutely not. Strokes happen really quickly. They happen suddenly. There's no warning. There's nothing that you can notice. So please don't beat yourself up about something you should have or could have done. There's absolutely nothing that you could have predicted this. Okay, it just happens. Okay, it's very sudden. Just you're talking about your family. Yes, I think you should phone them, and we'll help you with phones and outside lines to Canada, and we can tell you what to say, or we can even speak to them.
Well, how long do you think she has?
It's almost difficult to say. It may be as short as a few hours, but it could be longer, and I just can't predict what will happen there. Okay. What we plan to do is to move her into a side room and make sure that she's as comfortable and as pain-free as possible. Now, she's not in pain at the moment, okay?
Right.
Now, you'll be thinking, what happens next, or where do we go from here, okay? Now, we'll bring her up, we'll put her on these medications to calm things down, okay? And then we'll keep a very close eye on her. You may notice that her breathing changes, okay, and that's a sign that things are getting a bit worse, okay. Now, I think when she does come up here to the ward and we're looking after her, comfort and dignity are the main things that we should be aiming for.
Yes.
And if, I suppose, dare I say it, the worst happens and she dies, my plan would be to keep her as comfortable while she's dying as possible, okay, to give her some dignity right at the very end of her life, okay. And I'll sign a form so that when her breathing and her heart stops naturally, she's left alone, okay. Now, this has been a huge amount for you to take in over the last 5 minutes, okay. But I think it's probably most important that you're in with your mum and you get your family around you, okay. So we'll help you get that sorted. And if you have anything you want to ask us now, anytime, doesn't matter. Just ask a nurse and they can ask us as well.
Yes.
Okay.